together for several years on this committee, and I look forward to continuing with you in our new roles. I always want to take a moment, too, to recognize Senators Collins, and I know Senator Murray will be here shortly. As the chair and vice chair of the Appropriations Committee, they are committed to regular order and maintaining our track record of writing and maintaining and passing bipartisan appropriations bills in a timely manner. Today's budget hearing is a first step in that process. Secretary Kennedy, thank you so much for being with us today. I know that we all share the goal of improving the health of Americans. This hearing is an important opportunity for the subcommittee to hear from you on the HHS's budget proposal and better understand your priorities for fiscal year 2026. You've taken the helm of a large agency with thousands of dedicated career staffers whose work each day makes Americans healthier and safer and ensures our global leadership in science and biomedical research. In your first few months as Secretary, you've made many changes in the department that will lead, I believe, to a healthier America. This committee looks forward to hearing more from you on the details of your proposed reorganization for HHS and working together to make America healthy again. HHS has always worked with Congress when considering and designing reorganizations, and I encourage you and your staff to work closely with us as you move forward. Your fiscal year 2026 budget proposes a reduction in funding for HHS of 26%. I would say ask you to take a careful look at each and every program at the department, and I look forward to reviewing your full budget request, hopefully very soon. This committee wants to work with you on improving HHS so that the agency can move more efficiently and fund the basic science. I'm concerned that our country is falling behind in biomedical research, and this should be a concern for all of us who want to make investments in biomedical research. Investing in that has proven to save lives while exponentially strengthening our economy. NIH-funded basic research is also behind many of the 600-plus new cancer treatments that FDA has approved over the last 20 years. NIH-funded research led to the development of buprenorphine, a medication for opioid addiction. NIH-funded research led to the development of the first overdose naloxone nasal spray, Narcan. For almost a decade, this committee has increased funding towards the goal of finding treatments and a cure for Alzheimer's disease. This goal is very personal to me since both of my parents lived with and eventually succumbed to this horrible disease. These investments have allowed NIH to fund research into a wide variety of potential causes of the disease and build evidence for prevention based on a healthy lifestyle. NIH-funded research of the amyloid protein led to the development of the FDA-approved Alzheimer's drugs in 23 and 24 to slow progression of the disease. All this research is extremely important, and I look forward to working with you to continue to look at diversified Alzheimer's research. Wasteful spending of taxpayers' dollars must end, and I applaud you for taking a hard look at what federal research dollars are funding, and I encourage you to ensure that the fiscal year 2025 funding that Congress has already appropriated is spent in a timely manner, in particular for the vital biomedical research which could lead to life-saving breakthroughs in science. Too many families are waiting for a cure, as you know. We have a responsibility to make sure their taxpayers' dollars fund that research. You and I have talked several times, and I appreciate it so much, about the importance of the NIOSH coal programs in West Virginia and how the work conducted by NIOSH in Morgantown is unique across the federal government. I'm pleased that you brought some of these specialized NIOSH employees back to work earlier this month and then just last week reversed their rifts so that their return to the office will not be temporary. Thank you. Your decision to return NIOSH staff to the office meant that the Firefighter Fatality Investigation and Prevention Program could issue the final report on the December 27th, 2020 fire that killed a 30-year-old firefighter and injured 3 others in West Virginia. Senior Airman Logan Young was one of many who responded to the Carneysville fire. I'm glad NIOSH was able to finish their investigation and issue recommendations and final report. While your action last week was a good step, there are still other divisions within NIOSH with specialized staff who conduct essential, unique work. I support the President's vision to right-size our government, but as you and I have discussed, I don't think eliminating NIOSH programs will accomplish that goal. I encourage you to look at this closely. West Virginia, my own home state, continues to rank above the national average in both new cancer diagnoses and death. We are thankful for the work performed by the CDC National Center for Chronic Disease Prevention and Health Promotion. And I look forward to learning more about how this important work will be continued under the administration of A Healthy America. Substance abuse challenges also continue to be a real problem facing West Virginia and the nation. SAMHSA funding has played an important role in West Virginia, and I want to understand how the budget proposal would impact my state. I look forward to learning more about that from you today. I will say there was a bit of good news, I believe, last week when the national statistics of overdose deaths did go down. Rural health care is a top priority for this body. CDC data shows that rural Americans are more likely to suffer from higher rates of diabetes and are more likely to die from cancer, heart disease, and stroke than urban Americans. This is unfortunately true in my state, which also leads the nation in diabetes and heart disease. Improving rural health outcomes goes hand in hand with investing in the healthcare workforce to meet the physical and mental health challenges in America. HRSA has been a trusted federal partner on rural health issues for decades. HRSA has funded critical rural health capacity building and other initiatives across the country and administers the healthcare workforce programs that help bring medical providers into local communities. You have proposed moving HRSA into the new AHA, and is that how I say it? AHA. I would like to learn more about how your budget proposal would invest in rural America. We have a difficult task ahead of us, but it's my hope we can and will come together, just as we have done in prior fiscal years, to use our limited resources in the most efficient and effective way. So, Secretary Kennedy, I look forward to your testimony, and I now will yield to my, or not yield, but turn the microphone over to Senator Baldwin.
Thank you, Chair Capito, and I, too, look forward to continuing our strong bipartisan work together. Secretary Kennedy, today we are here to talk about your fiscal year 2026 budget request to Congress. You run a department dedicated to improving the health and well-being of every American. And these programs that you are responsible for administering touch the lives of all Americans at a critical moment in their lives, from research for life-saving cures and treatments for devastating diseases, to maternal health care, to child care, to addressing substance use and mental health. You have repeatedly pledged that you would run the department with, I quote, radical transparency. While this is a great catchphrase, it could not be further from the reality that we're experiencing right now, as we talked about yesterday. As required by law, a few weeks ago, the department sent this committee a plan for how it will be spending appropriated funds this year under the CR. But instead of providing Congress and the American people with any information about how the department is spending tens of billions of taxpayer dollars, there are only asterisks in place of spending levels for over 530 programs. In no other job under the sun can you essentially leave blank how you are spending billions of dollars. This is flatly unacceptable when we are talking about taxpayer dollars, and the people I represent deserve better. You are undertaking a massive and disruptive overhaul of the department. You are shutting entire offices down and firing thousands of experts. Your plan for all of this that you provided to Congress is little more than 1 page long. And that shows the chaos that this is creating. I'm assuming today you're going to reiterate talking points about how you are consolidating offices and eliminating duplicative functions. But Secretary Kennedy, this is a genuine request. Please sit down and talk to us in detail about what you are doing. Have your staff talk with our staff on both sides of the political aisle about your plans for the department and what you are doing right now. For a department this important, anything less is simply not acceptable. Let me turn to what it is that we do know about your budget request and what is happening at the Department of Health and Human Services. Your fiscal year 2026 budget requests cuts to the National Institutes of Health of $18 billion. That would have a devastating impact on research into life-saving cures and treatments for devastating diseases. setting back medical innovations by decades. It would push the brightest scientific minds to work in other countries. It would cede our leadership in biomedical research to China. It would also take away hope from millions of American families. For the family receiving a devastating diagnosis of pediatric cancer, like Charlie and her mom, Emily, who spoke to this committee last month, it would mean less hope. For Jesse, a veteran and a father with ALS, and his son Dewey, who wants his dad to see him graduate from high school, it would mean less hope and less time. This budget says a lot about the priorities of this administration. And normally I could, I guess, disregard it as only a request. But it provides insight into what you're doing right now in fiscal year 2025. At the same time you are submitting this request, you are actively stopping billions of dollars in NIH funding for life-saving research, including on cancer and Alzheimer's disease. You are implementing changes right now that are ripping away hope and life-saving cures from American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate offices is endangering children, including thousands of children in Milwaukee. If you have a proposal to make these programs work better, present it and justify it. Mr. Secretary, you will say that you have to fire thousands of employees and eliminate programs like LIHEAP because our deficit is too large. But you won't mention that at the same time this administration is proposing these cuts, it's proposing tax cuts for billionaires that will add trillions to our debt. You are cutting programs and firing staff with no plan and no understanding of what the department you are leading even does for the American people. And that's why you had to rehire staff working on the World Trade Center health program and screening coal miners for black lung disease. You fired everyone, and now you want to take credit for hiring them back? That's not how this works. Congress provided over $360 million on a bipartisan basis for NIOSH. You eliminated the entire Safe to Sleep program that the Eunice Kennedy Shriver Institute. Safe to Sleep is one of the most successful child safety campaigns in history that prevents 1,500 babies from dying each year, at a time when we are seeing rates of SIDS starting to climb. Without staff, these programs are meaningless, and this is happening across HHS. I could go on and on about how this administration's careless and reckless approach is hurting the people of Wisconsin and this country. These are just a few examples. Mr. Secretary, this committee has worked in a bipartisan manner to improve child care options for working families, address the substance use disorder crisis, support seniors and people with disabilities so that they can live in their communities, and to make the United States the leader in biomedical innovation. You're implementing changes right now that are dismantling our progress, and you're hiding it from Congress and the American people. We don't need to just reject this budget request. We need to reject what's happening at HHS right now. We need to do that before you have caused irreparable harm at the department and the programs it administers that millions of Americans rely on. I yield back.
Thank you. Secretary Kennedy, we welcome your opening statement.
Is it on now? All right, thanks. Thank you, Chairwoman Capito, and thank you, Ranking Member Senator Baldwin, and all the members of this committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health affect families across every race, class, and political belief. And my team and I took the helm at HHS. We set out with clear goals. First, we aimed to make America healthy again with a special focus on chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs for taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developing nation, despite the fact that we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong. All the money that we've been pouring into these programs for years has not resulted in better health for Americans. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, veterans, American Indians deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary health care physicians. We will prioritize these families, especially the Native American and Alaskan communities. Protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease and their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulation, inspection, and education to remove harmful chemicals from food and packaging. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs, as we did last week when we approved South Carolina's application for support for a program, the first program in the country that provides cell therapy and gene therapy to every person in South Carolina who has sickle cell anemia. For fifth, we will eliminate DEI funding and redirect. Sixth, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we will be the cutting-edge agency using this technology to manage healthcare data more efficiently and securely, and to give Americans control over their own health. Finally, we will rebuild public trust that eroded through years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency and public service, creating an honest, science-driven HHS that answers to the President, to Congress, and the American people. And I just want to say, salute the people wearing purple in this room. I assume as an emblem of their commitment to solving the Alzheimer's crisis. And Alzheimer's is a very, very good example of how NIH has gone off the rail over the past 20 years with research on amyloid plaques and cutting off any other hypothesis because of corruption within the agency. And that has derailed Alzheimer's research in this country for 20 years. And I'm committed to solving the problems of Alzheimer's, also understanding why we're having an epidemic of Alzheimer's, why it is increasing. And I have Alzheimer's in my family, and many members of my family are activists in this community, and I have a deep personal commitment to solving this issue. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again.
Thank you, Mr. Secretary. And I am going to turn to the chair of the full committee, who we're honored to have here, as always, Senator Susan Collins, for 7 minutes for questioning.
Thank you. Thank you very much, Madam Chair, and I thank the Vice Chair as well. Welcome, Secretary Kennedy. Secretary Kennedy, the military services submit to Congress what is known as an unfunded priorities list. It includes funding requests that were not included in the President's budget, but oftentimes we take from that list and do fund what the military was unable to get into the President's budget. And just to give you some idea, the unfunded priorities list range from more battleships to better housing for our troops to weapons R&D. It really covers the map. Your department's budget has been sharply cut by 26% below the fiscal year 2025 level. If you were required, as our military services are, to submit an unfunded priorities list, what would you include on it?
That's a good question, Senator. I would include the research that has been neglected for the past 20 years on chronic disease and what's caused us to go from 3% of Americans of children having chronic disease when I was a little boy and my uncle was president to 60% today. I would want to look at the thousands, over 10,000 chemicals that are now in our food. Most of them have never been tested. I'd want to look at what's causing the infertility crisis. Why are girls in this country reaching puberty 6 years early, earlier than historically? Why do boys in this country have half the testosterone teenagers of a 68-year-old man, half the sperm count of a 60-year-old man? I would want to do research on why our bees are disappearing, why 90% hive collapse happened, which is a food issue. I would want to look at the microbiomes in the soil and how that's contributing to erosion and how chemicals that we're using in agriculture are sickening farmers in many cases, potentially, and are destroying the microbiome and creating a situation where soil is running off and where most agronomists believe that we only have 60 harvests left. And I would want to look at why we're having an explosion in Alzheimer's in this country, not just curing it, but what is causing it. And I think NIH has done a very good job at making cancer more survivable. For example, colorectal cancer, where there's been extraordinary science done at NIH. Why isn't NIH asking the question, why do we have colorectal cancer in children? This is something that's new to humanity. It was never known before. And now it's an epidemic in our children, and we need to have a balance where we're looking at cures for diseases, but we're also focusing on how to keep Americans healthy so that we can beat these ruinous healthcare costs and that we can have a healthy, productive society.
Thank you. I want to turn to a couple of other issues. First of all, the LAHI program, which we've talked about, is absolutely vital for thousands of older Mainers and low-income families. It helps them avoid the constant worry of having to choose between keeping warm, buying essential foods and medications and other basic necessities. Now, I was pleased to see the release of the rest of the fiscal year 2025 funds, but the administration's new budget seeks to eliminate what is truly a critical program. Will you work with this committee in trying to restore the LAHI program so that we can avoid literally seniors and low-income families not being able to keep warm in the winter?
Yeah, absolutely. And I'm from New England. Myself, my brother, for 40 years has run a Citizens Energy, which provides low-cost home heating oil to families in New England. And so many people have come to me over the years and said to me, "Thank you, your brother saved my life," because I didn't have to choose between food and heat. I was on the Navajo reservation 3 weeks ago, and Navajo President Boo Nygren said to me, if we cut LAHI, Navajo will die from it. So I understand the critical historical importance of this program. President Trump's rationale and OMB's rationale is that President Trump's energy policies are going to lower the cost of energy so this program, so that everybody will get lower cost heating oil. And in that case, this program would simply be another subsidy to the fossil fuel industry. If that doesn't happen, then I would, and Congress chooses to appropriate the money, I, of course, will spend it. I've already directed the spending of $400 million in this year's budget to that, and I will work with you to make sure that those families do not suffer in that way.
Thank you. You and I have had many conversations about Alzheimer's disease and the BOLD Act. I do want to point out the CDC's cooperative agreements for the Healthy Brain Initiative, and 3 dementia public health centers of excellence under the BOLD Act are set to expire at the end of September. We initially expected that the CDC would put out a notice encouraging applications early this year. Inexplicably, no such notice has been issued, even though we reauthorized the BOLD Act and funding is available under the appropriations measure that President Trump signed into law in March. How and when does HHS plan to issue this notice of funding opportunity so that we can continue what has been a very effective approach to the Healthy Brain Initiative and Centers of Excellence? It helps caregivers. It encourages early diagnosis. It really has been an important program, taking the kind of public health approach that you've generally supported.
Yeah, Senator, because of the TRO from the federal judge on this issue that was issued last week, I've been instructed by HHS and by White House attorneys that I can't speak directly to that part of the reorg. I have a strong personal commitment to, as I said before, to Alzheimer's, to dementia, and it's affected members of my family, and I understand how important these programs have been. And whatever happens, we will continue that research.
Senator Baldwin.
Thank you, Chair Capito. Secretary Kennedy, very quickly, when I ask you for information or my staff asks your staff for information, do you commit to responding?
Yes, Senator, of course.
And when might I expect a detailed operational plan? I've referenced in my opening statement the fact that 530 programs or activities, when you provided that information, had an asterisk in place of a dollar amount. When might I expect the detailed plan? When?
As I explained to you, those decisions are being made by OMB. And
So you're really not in charge of the spend plan
this is not a HHS issue. It's a government-wide issue.
Okay, so the Secretary of HHS is not in charge of the spend plan for 2025. I'm going to move on. Research funded by the National Institutes of Health has pioneered the development of new technologies and cutting-edge treatments, including immunotherapies that are saving lives and giving millions of Americans suffering from devastating diseases more hope and more time with their families. Last week, American doctors made history with the world's first successful personalized gene editing treatment in a 9.5-month-old baby boy, curing him of a rare, life-threatening genetic disorder. This technology is miraculous, and it was made possible by NIH research. According to the American Cancer Society, NIH-funded cancer research saved 3.5 million lives between 1991 and 2019 and reduced the overall cancer death rate by 33%. Congress has spent nearly 100 years building up the world's premier biomedical research agency to develop state-of-the-art treatments that wouldn't have been thinkable just decades ago. And in just 100 days, this administration is starting to tear it all down. NIH has awarded nearly $3 billion less in funding. So the graph on on my right, $3 billion less in funding compared to the same period last year. That's more than 3,200 fewer grants. These grants are being withheld. This includes funding for everything from cancer to Alzheimer's disease to rare disease research. Secretary Kennedy, whose decision is it to withhold thousands of grants and billions in funding for life-saving medical research at NIH?
I can tell you, Senator Baldwin, that gene therapy and cell therapy is a priority for me and for Marty McCary, who's the FDA director. We are going to ensure that this country remains the hub of gene therapy.
That wasn't
and
my
cell
question. Secretary Kennedy, whose decision is it to withhold thousands of grants and billions in funding for life-saving medical research at NIH that we approved on a bipartisan basis in this subcommittee?
We are not abandoning any life-saving research. At
Is it
NIH.
DOGE reviewing NIH funding opportunity announcements?
Is
it DOGE reviewing NIH grant award?
We've got administrators, we're cutting waste, we're cutting duplicative programs.
You're funding $3 billion less in biomedical research than you did a year prior.
We're spending less on administration of those programs.
3,200 fewer grants.
We're spending, well, many of the grants were terminated because they were grants that were not advancing.
These aren't grants terminated. These are grants not awarded because the panels weren't convened.
We spend 70% of the world's biomedical research out of NIH, 70%, and we're the sickest country in the world.
$18 billion or 40% from the NIH budget slow the development of new treatments and cures?
And we are the sickest country in the world, so that money has not been well spent. We've had a 38% increase in our agency, growth in our agency over the past 4 years.
I'll ask you, is funding for Alzheimer's disease research centers DEI? Because you're holding up $65 million for 14 of those centers in 9 states, including the University of Wisconsin-Madison. Is funding for cancer centers DEI? Because you're holding up $47 million in cancer center support grants at 9 cancer centers in 8 states. Is funding for rare disease research DEI? Because you're holding up $55 million for 11 rare disease clinical research network grants in 8 states. These are just a few examples, and the list goes on and on, Secretary Kennedy. I've run out of time. I yield back.
Thank you.
This is a fun game we're playing.
Mr. Secretary, let's talk about clinical
questions and to ask questions and don't give me a chance to answer them. Don't give me time to answer them.
Well, maybe in some of my questions you can elaborate on some of that. I want to ask you about the clinical trials because she does have that up on her poster there. Clinical trials are the forefront of research, innovation, and oftentimes represent that last hope for cancer patients and other patients addressing chronic disease when traditional treatments have been effective. These clinical trials often lead to getting life-saving drugs to the market. Has HHS or any sub-agency assessed the impact of patient access to clinical trials through the reorganization effort?
We are not cutting any clinical trials. We are not cutting any clinical trials. We're not cutting drug development.
Thank you.
Cutting administrative costs.
A question on indirect costs, because, this is a biggie. When it was announced that that NIH announced it would cap indirect costs at 15% for research. We talked about this actually in our meeting. We talked about the possible adverse effects of this. And like I've heard from West Virginia University, Marshall University, which receive smaller amounts, but I've heard from everybody across the country in terms of the research. West Virginia University is a member of the Association of Public and Land-Grant Universities, and they are working along with schools and independent research organizations across the country to come up with a new model for indirect costs. Are you aware of this effort, and have you met with them to discuss their work?
I haven't met with them, but we are talking with lots of people about a new way to fund indirect
Are you aware
costs.
of the effort that's going on with a whole bunch of stakeholders that are trying to figure out a way to do this better?
Yes, we are, and Jay Bhattacharya is very interested in this. And as you know, Senator, there were some of the private universities that were abusing that. We had Stanford, which has tens of billions of dollar endowment that was using our money. We wasted $9 billion last year of NIH's budget on indirect costs. We're paying some of these universities up to 78%. That money was not going to research, not all of it. In the public universities, we are very much aware that those universities are using the money well, that it is absolutely necessary for them. And we're looking at a series of different ways that we can fund those costs through them, but not through the independent, indirect cost structure, which loses all control, which deprives us of all control of how that money is spent.
Well, in my many conversations with a lot of the research, because I don't think anybody here wants to lose our valuable research, and I put you in that bucket as well. I do know there's a recognition that there's not enough transparency, that the system needs to change, and so this group that's being put together, I think, is very thoughtful in their approach, and I would encourage you, as you've already done, with the head of NIH.
Yeah, and I'm happy, Senator Capito, I could talk to you right now in detail about some of the alternatives that we are considering.
Okay.
But we are taking it seriously, and we understand. But in Maine, at the University of Maine, the University of Alabama, many of these other state schools badly need this research. They're doing cutting-edge research, and they need that money that was going through indirect costs, but we think there's a better way to pay that out.
Okay. Well, we want to work with you on that. Let me talk about rural health. I mentioned it in my opening statement. I know you've been to our state, so you understand the rural nature of many of our states. There's such significant healthcare challenges in rural America. A lot of it around access. The rates of chronic conditions like diabetes and heart disease are among the highest in the country in rural America. HRSA programs are critical to rural health and initiatives. And you've, in your budget, announced a cut to HRSA programs. I am concerned about that because of the access issue and because of the inequities that I think I see, and I think we see sometimes between where people have easier access to health care than in rural America. You got transportation issues, you have connectivity issues, you have just generational issues of passing down different diseases. How is rural America going to be better under your new reorganization?
There's a lot of ways, as you point out, under HRSA, and this is a priority for me. It's one of the commitments I made. When I was doing my Senate confirmation, it was the issue that was most often raised by the various senators who I talked to. These facilities, we're seeing an epidemic of closures in rural hospitals, rural areas around the country, and these not only provide critical access to care. If you don't have that hospital, people may have to drive 2 or 3 hours to get to a site, and that means people will die. They also are critical to the economy and the culture of rural America. They provide jobs and high-paying jobs, and they're economic drivers for those communities. So we're determined to keep them open and to do everything that we can to help them. And we're doing that through a combination of different ways under HRSA, through the community health centers, the National Health Service Corps, which provides badly needed personnel, which is a huge deficit in rural areas. The GME program, which does education for those through rural health, but also through innovations like to provide better health care through telehealth and through AI and through wearables and apps that can actually save people hospital trips. I spent 2 hours yesterday meeting with the CEOs of some of the biggest and most effective health tech companies in the country, and the potential that we have to transform rural health care. For me, I walked out of that meeting very, very optimistic and very excited about the capacity that we now have through technology and AI to transform, to save, to rescue rural health care around this country.
Thank you very much. Senator Durbin.
Thank you for being here, Mr. Secretary. Let me ask you a startup question. Do you know the #1 cause of preventable death in America today?
The #1 cause? Well, I know what the #1 cause of deaths is in this country. I'm not sure what you're talking about.
I'm talking about tobacco. You fired the head of the CDC's Office of Smoking and Health and eliminated their efforts from your budget. Hundreds of employees at FDA's Tobacco Center, including the director, have been let go. If we are genuinely concerned, and I believe you are, about the health of America and making it better, something as basic as the #1 preventable cause of death, is not served by that kind of dismissal. Let me take you to another issue that I think is personal to me in a way. It reflects a tragic situation involving ALS. A friend of mine named Brian Wallach used to work in the Obama White House. And Brian met his wife-to-be, Sandra Abravaya, who was my press secretary. They married. When their second daughter was born, Sandra came home from the hospital to learn that her husband had ALS. Brian and Sandra have been fighting a battle now for 8 years. He's still alive. He can no longer walk or talk, but he has hope. He loves his family, and he's hoping that something will break through in ALS that gives him a chance for a future. Please explain to Brian and Sandra and their 2 young daughters why you've canceled ALS grants at institutions across this country and why you think research for diseases like ALS should be cut by 40% next year.
Senator, I don't know about those cuts. I will have to, I don't know if that's true. I don't know if those were part of the rifts, in which case the people were not fired, but they were put on administrative leave. The issues that you're talking about are issues that are important to me: tobacco, ALS, and I know you have a passion for congenital heart disease as well. Those are all issues that I'm deeply concerned with, and I'm happy to meet with you at any time and talk about the programs and what we can do to make them better.
Of course, you're welcome, and I think the conversation is important. But I want to remind you, on April 1st, 10 laboratory heads at National Institute of Neurological Disorders and Strokes received their layoff notices. They were all PhDs and senior investigators. They're not administrators, whatever that might be. They were running intramural labs at NIH. If you have your way, they'll all be gone on June 2nd. Science Magazine reported 25 of 320 physician researchers at NIH's Internal Clinical Center are leaving, and the number of patients treated in the hospital has been reduced by 30%. 3 grants involving ALS and dementia work at Northwestern University in Illinois have been paused. One looking at how to stop the buildup of damaged proteins, another looking at cellular mechanisms that can be drug targets. Just last week, an ALS researcher at Harvard had his grant cut that was using AI to accelerate the reversal of ALS symptoms. Brian Wallach is waiting for a cure. He is not giving up. His source of hope is this research that you unfortunately are terminating. How can we possibly address his concerns and give hope to people across the country who are suffering for so many diseases when our government is cutting back on that research?
As I said, Senator, I do not know about any cuts to ALS research, and I'm happy to meet with you.
I just read them to you.
I will have to go and talk with Jay Bhattacharya and find out what the rationale was for those cuts. I just don't know about them until you told me about them at this moment.
There are many things that concern both of us about the state of public health in America. And questions you've raised, I think, are legitimate questions, many of them, that I want to follow through. I want to know the honest scientific answer to these questions. And I want to make this point. Cutting medical research is giving up on the future. You can't do that. These families are counting on you, Secretary, and counting on your department to do this research. It gives them hope to live another day. Just turning out the lights and saying you're doing it in the name of efficiency or DOGE or whatever it is no consolation to these families that are struggling. Thank you, Madam Chair.
Senator Moran.
Thank you, Chairman. Secretary, welcome. Kansas, my home state, is one of several states that are facing the impact of a recent measles outbreak. We had 56 cases confirmed measles, with 54 cases being in a southwest part of our state. Among the 54 outbreaks, 48 of those patients were unvaccinated or had unknown vaccination status. Overall, the state's cases, 45 of those patients or victims of measles were children. What do you need? What do you need from us? And what can you do currently to be of help to the Kansas Department of Health and Environment in support of their response to ensure that this outbreak doesn't spread and to make sure that those who have been positive for measles are cared for, and this becomes a thing of the past, not a thing of the future.
Yes, Senator. The best way to prevent the spread of measles is through vaccination. We urge people to get their MMR vaccines. There are groups in this country that don't want to be vaccinated many of them for religious reasons. I spent a lot of time with the Mennonites, and the MMR vaccine has millions of fragments of human DNA in it from aborted fetal tissues, and that's a religious objection for them that I have to respect. We need to be able to treat people who do get sick, which the CDC does not give people advice, physicians advice on now until I came in, and we started a new program to treat people who actually get sick. We've done a better job at controlling measles since I came into this agency than any other country in the world. Today we're at 1,035 cases, and we only added 27 cases last week. Canada, which is 8%, 1/8 of our population, has an outbreak double that size, and they added 300 last week. Mexico, which has a population a third our size, has almost the exact number of measles that we do. Europe has almost 7,000 cases, so 7 times what we have. And they're growing and adding cases. We've deployed the epidemic intelligence services to all the states that have requested our help. We have people on the ground in those states, and they are doing a great job at limiting the spread of the outbreak. And if the governor of Kansas wants to contact us, we will deploy a team to Kansas to make sure that outbreak is curtailed there.
Do you have all the tools at HHS to be of help to Kansas and other states?
We do. We not only have tools like vaccination and the tracking and tracing and surveillance and analytics and lab support, we also now are for the first time are able to provide physicians with at least some treatment protocols so that when children do come to a hospital with measles, there's a protocol for treating them. Most children, virtually no child should die of measles. We've only had 4 measles deaths in 20 years in this country. And even before the introduction of the vaccine, the death rate for measles is about 1 in 10,000. So healthy children should not die from measles, and there's ways of treating most of the kids who died either have comorbidities, but in addition to comorbidities, they have bacteriological infections that are associated oftentimes with measles, and we need to give the physicians the tools to treat those bacteriological infections. And they have not had that. CDC has never given them those protocols because it's one solution only, and it has not been a good system.
You have demonstrated a support for people with developmental disabilities. Could you talk about that commitment to supporting the work of developmental disability networks and how the federal government can continue to support Americans with intellectual and developmental disabilities?
I mean, this is a lifetime passion for me, but also a family passion, and we will continue to provide that support and to provide the best science that we can.
And I want to follow up with something that Senator Collins said in support. I want to share my support for the BOLD Act, the Bold Infrastructure for Alzheimer's Act, and again indicate the value of the continued and intense effort of trying to find the cure and treatment for Alzheimer's. Anything you'd like for me to know?
Well, I alluded to this earlier on, but the NIH really went off the rails on Alzheimer's research 20 years ago. One of the favorite researchers, the part of the old boys club at NIH, developed a hypothesis that Alzheimer's was caused by amyloid plaque buildups. After that, NIH suppressed any science and refused to fund any science on alternative hypotheses. We are going to change that.
Today, fully committed toward the research to?
Yeah, absolutely. We're going to find what causes Alzheimer's, what is causing the epidemic of Alzheimer's, and we're going to find a cure.
Thank you.
Senator Reed.
Mr. Secretary, I want to ask you about the CDC's childhood-led program, because we've heard a lot of conflicting messages about
Childhood.
Yes, the childhood-led poisoning prevention program. But we've heard a lot of conflicting messages. First, the program was eliminated as part of your restructuring of HHS, and all the program staff was fired. You suggested that that was a mistake and that the program will be brought back online. Last week, you told Senator Baldwin that lead poisoning among children was a very significant issue, and if Congress appropriated the money, the program would continue. Well, Congress has appropriated the funding, and as far as we can tell, staff has not yet been hired, and I see no statements reversing your decision to eliminate the program. So which is it? Do we have a program?
We are continuing to fund the program, and in Milwaukee, we have a team in Milwaukee, and we're giving laboratory support to the analytics in Milwaukee, and we're working with the health department of Milwaukee.
Well, that's Milwaukee. What about the rest of the country?
Well, I don't. As I said, I have a TRO now. You know, a federal TRO that does not allow me to talk about the reorg. What I can tell you is that if you appropriate the money, that we are going to spend it.
We have appropriated the money, Mr. Secretary. You indicated that you have a program in Milwaukee. What about the rest of the United States? This is not a problem exclusive to Milwaukee.
My understanding is that that program is continuing. I'm hoping to. I'm very, very happy to talk to you, Senator, after this and find out exactly what the details are.
Well, it should be a very simple answer. The program's back up and running. We've hired the staff, which I don't think you have, and that doesn't indicate that you're serious about getting the program running again. I just want to put a word in to second Senator Collins' support of the LIHEAP. It's a program that is incredibly important to people all across the country. Cold winters, torrid summers in the South, people need it. And I support her comments very much. Now, let me turn to an issue, Medicaid. The Nonpartisan Congressional Budget Office estimates that more than 10 million people will lose access to Medicaid because of the bill under consideration right now in the House. In fact, CBO didn't even get to score all of the Medicaid provisions, so it could be higher. But the consequence of that is millions of people losing Medicare will mean that many more people will go to the emergency rooms because they don't have a doctor. Many community health centers will close because that's the margin that keeps them open. Nursing homes will likely close. In fact, frankly, it will probably undermine significantly the healthcare systems in every state in the union. So why are you making these cuts?
First of all, we haven't made cuts. We've only in Washington would those be called cuts. The reductions that are proposed are reductions in the rate of growth over the next 5 years. And those reductions are to eliminate waste, fraud, and abuse. And I'll explain to you, there's 1 million people now on Medicaid who are accepting Medicaid, or collecting from Medicaid in 2 states. That's illegal. They're stealing from the Medicaid program. We've now been able to identify them, which no other administration was able to do. There are 2 million people who are collecting both Obamacare, or 1 million people who are collecting Obamacare and Medicaid. That's illegal. It is also a theft. There are 1 million illegal aliens in the states that have allowed that, like California. And as soon as we made the announcement that we are not going to allow that funding anymore, Gavin Newsom followed by making his announcement that he's not going to fund it anymore. So his compassion ended where he had to start paying for it. The remaining, and there's only 8.5 million people affected by this. The remaining people who are affected are able-bodied male workers, males, who refuse to get a job, who refuse to even meet the minimal thresholds that President Trump has demanded, that
Excuse
they be
me, Mr.
looking for a
Secretary.
job, that they be
Mr.
getting
Secretary,
education.
excuse me, Secretary. That's rhetoric, not reality. You're going to have 10 million people without health care. They're going to the emergency rooms. It is going to undermine the health care system in every state of this country, and you'll be responsible along with the president. Thank you.
Senator Kennedy.
Mr. Secretary, how many employees were there at HHS when you took over?
82,000,
How many do you have today?
62,000.
Okay.
It's about the level it was in 2019, right before COVID.
Is this the first time that an institution in America has ever downsized?
I don't think so. I think private and public institutions have history.
Microsoft just announced that they were going to reduce their workforce by 6,000 people. You think that'll be the end of Microsoft?
Senator, we wouldn't have reduced anybody.
You think that'll be the end of Microsoft?
I don't think so, Senator.
Meta, I still call them Facebook, just announced they're going to reduce their workforce by 3,000 people. You think that'll be the end of Meta?
I imagine it will not.
Yeah. Think maybe the people at Meta know what they're doing?
I think that they do. They make a lot of money, Senator.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs at NIH.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes $30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in
way to
Louisiana, we
spend
call that
federal
stealing.
taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university? Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they paid 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay. I want to ask you about LAHEAP. Are you familiar with this GAO report they did on LAHEAP? LAHEAP?
I am not, Senator.
They found, they audited 7 states. They found 11,000 dead people getting LAHEAP grants. You familiar with that?
No, but that is pretty typical of many of the other programs that we're working with.
They found prisoners getting grants, didn't they? Were they using the grants to heat their jail cell? They found 1,000 federal employees getting the grants. with federal salaries that greatly exceeded the income limits. They found some of those folks living in million-dollar homes. I got 18 seconds. Why do we allow highly processed foods in America?
That's a complicated question, but it's driven by profits, but to a food industry that is making money by poisoning American kids, and they don't do it abroad. They make the same products for Canada and for Europe that do not contain many of those chemicals.
You understand, Mr. Secretary, there's nothing you can do that's going to make many of my Democratic colleagues happy. You get that, don't you?
I do understand. I'm coming to understand that, Senator.
Yes. Thank you.
Senator Murray, welcome. Nice to see you, and I'll turn it over to you for questions.
Thank you very much, Chair Capito, Senator Baldwin. I look forward to working with you both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in child care funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now, in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claimed that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut. later going on to say there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and child care. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another child care issue. Secretary Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point out.
I have just 2 minutes left. I asked you a specific.
I want to point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary, I am
epidemic
here
of
to
chronic
ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about
front-
the epidemic
Mr.
of chronic
Secretary,
disease?
seriously, Madam
Mr. Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, we were not cutting thousands of scientists, we are not cutting clinical trials, but I want you to know in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information
I agree.
anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff
Madam Secretary,
2 weeks ago.
Mr.
2 weeks ago,
Secretary,
you were corresponding.
seriously.
What you said, you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Senator Hyde-Smith.
Thank you, Chair Capito and Ranking Member Baldwin for this meeting, and thank you, Mr. Secretary, for being here. I'm going to get right to the point because I want to make the most of my time. I could not be more supportive of this administration's goals to improve mental and physical health of all Americans and to gain a better understanding of why our nation struggles in certain areas. However, I am deeply concerned with the reports from reliable sources that's now appearing in the media that the Maha Commission's initial assessment, which is expected to be released this week, may unfairly target American agriculture, modern farming practices, and the crop protection tools that roughly 2% of our population relies on to help feed the remaining 98%. I trust these reports are not true and that this initial assessment prepared over the course of 3 months is not intended to serve any hidden agendas. Hidden agendas such as suggesting that products that have undergone the EPA pesticide approval process, which is widely considered to have the most rigorous standards in the world, are unsafe. Let me be clear, human health comes first, number one. It's a priority, and we certainly want that. But a vital component of human health relies on access to safe, affordable, and abundant food supply. If Americans lose confidence in the safety and integrity of our food supply due to the unfounded claims that mislead consumers, public health will be at risk. I've said this before, and it's worth saying again. Countries have gone to war over many things: politics, religion, race, trade, natural resources, oil, pride, you name it. But threaten a nation's food supply and allow people to go hungry, let's see what happens then. Mr. Secretary, two key provisions of the MAHA executive order stick out to me with respect of our exchange today. One, subsection A of Section 2 states, all federally funded health research should empower Americans through transparency and open source data and should avoid or eliminate conflicts of interest that skew outcomes and perpetrate distrust. And two, subsection C of this section states, agencies shall work with farmers to ensure that the United States food is the healthiest, most abundant, and most affordable in the world. Mr. Secretary, with respect to the subsections that I just mentioned regarding conflicts of interest, skewing outcomes, and perpetuating distrust, do you think American farmers and ranchers will believe you're living up to this principle when they read your initial assessment later this week? And we all know with confirmation what confirmation bias is, and it's no secret that you were involved with pesticide litigation prior to becoming Secretary. Has your past or personal opinions influenced the initial assessment in any way? And regarding subsection C, how would you do things differently than what EPA and other federal regulators have already done? In the case of glyphosate, for instance, one of the most thoroughly studied products of its kind, we're talking about more than 1,500 studies and 50-plus years of review by the EPA and other leading global health authorities that have affirmed its safety when used as directed. Have you been able to refute thousands of studies and decades of scientific review in a matter of months? If you would answer those, and then I have some closing points.
Your information about the report is just simply wrong. The drafts that I've seen, there is not a single word in them that should worry the American farmer.
And you can prove that beyond a shadow of a doubt? That
you'll see the report. It's going to be released on Thursday. Everybody will see the report. And, there's nobody that has a greater commitment to the American farmer than we do. The MAHA movement collapses if we can't partner with the American farmer in producing a safe, robust, and abundant food supply. And we understand that. I said during my campaign when I was running for president, and I have said repeatedly throughout this process, we cannot take any step that will put a single farmer in this country out of business.
Okay,
there's a million farmers who rely on
to make my closing
glyphosate.
points.
There's a million farmers who rely on glyphosate. 100% of corn in this country relies on glyphosate, and we are not going to do anything to jeopardize that business model. We are.
But you're saying my comments are totally inaccurate. In today's
totally
world,
inaccurate.
there are people with impressive credentials, perhaps expert witnesses or organization with big names that are willing to say things that serve a particular interest or purpose, but what they don't say is that their feelings are premature or simply intended to satisfy a predetermined outcome desired by those seeking their opinion or validation. We have the Federal Insecticide, Fungicide, and Rodenticide Act and the exhaustive review process in place for a reason. I've yet to hear the approval process is easy, but it's going to be a shame if the MAHA Commission issues a report suggesting without substantial facts and evidence that our government got things terribly wrong when it reviewed a number of crop protection tools and deemed them to be safe. So, Mr. Secretary, we have to get this right. You have to be 100% certain, and the MAHA Commission needs to be able to refute years and years of scientific evidence and thousands of studies from credible entities before you start suggesting an initial assessment that the methods in which the farmers provide our food is unsafe. I trust your report will be described, an initial assessment of things to be considered, but yet to be determined. Thank you, Madam Chair.
Thank you, Senator Shaheen.
Thank you, Madam Chairman. Mr. Secretary, New Hampshire is one of those states that has really been devastated by the opioid epidemic. For too many families, this isn't just an emergency, it's a daily heartbreak because they've lost people they love. During the first Trump administration, I worked closely with Health and Human Services to secure critical funding for New Hampshire through the state opioid response grant program. That funding has saved lives. We've made sure in New Hampshire that nearly every paramedic, firefighter, law enforcement officer has access to life-saving naloxone or Narcan. And we've also supported prevention and recovery programs that are turning the tide against addiction. We are finally beginning to see our overdose death rate go down. But I am deeply concerned that this progress is now at risk because Health and Human Services has already clawed back nearly $5 million in mental health and substance use treatment funds that are allocated to New Hampshire. And now your budget proposes eliminating SAMHSA entirely and consolidating critical substance use and mental health block grants under a vague framework that's not at all clear to me. So, Secretary Kennedy, will you commit to preserving the state opioid response grant program and to working with this committee, with my office, to ensure that states like New Hampshire, which are suffering from high rates of addiction, receive the funding and support that they need?
Senator, this is an issue that's very close to my heart. I lost a brother to this disease. I lost other family members. I lost a niece who is essentially a daughter to me. During the pandemic, I had my own 14-year struggle with heroin addiction, and it's always been a priority, and it will continue to be a priority for me. And I think all of the interventions that you talked about are interventions that we're going to support on Narcan, naloxone, naltrexone, Suboxone, methadone. My own bias is toward community care programs that I think are less expensive and the most effective, but there are many people who cannot take advantage of them, and we will continue to support the states.
Mr. Secretary,
state programs.
I don't want to interrupt, but I have read some reports of the struggles that your family has had, so I appreciate and understand why you would be sympathetic to this challenge, and that's why it's so hard for me to understand why you would be considering programs that have been working like the state opioid response grants, because what they do in New Hampshire, maybe they don't do this in other states, but in New Hampshire, those dollars go directly to the local treatment programs. We have a whole system that's set up based on those that allows people to get treatment and recovery in their communities, that's designed to ensure that they can get that. And so that's why I'm so troubled by the idea that you would eliminate the entity that makes those grants available.
Senator, we support 500 community care facilities around the country. We're going to continue to do that, and we will continue to support the most effective ways of ending the opioid. And we have not done a good job at that in the past. We can do a lot better. We need outcome-based care.
So, but you won't commit to preserving the state opioid response grants?
I have to look at that particular grant, but if it's working, we want to support it.
To move on to another topic, I co-chair the Senate Diabetes Caucus alongside Chair Collins, who I think has been here already today. We've spent years, literally, working to try and increase funding for diabetes research, to ensure access to new treatments. It's one of our most expensive chronic illnesses in this country. And yet earlier this year, your administration announced a pause on the Diabetes Prevention Program Outcome Study, which is one of those initiatives that's designed to help us figure out what the long-term impacts of diabetes are and how we can better intervene and promote alternatives. So this study, I think, is essential to understand how we better address diabetes, and you've consistently emphasized the need to improve chronic disease treatment in our country. So again, will you commit to funding this study so that we can continue to learn how to better prevent and treat diabetes?
I have no idea why that study was paused. If it was paused, I would have to talk to Jay Bhattacharya about that. There were thousands of studies that were put on pause and then refunded. I expect, knowing Jay's commitment to it, my commitment to that study will continue to be funded.
So you will commit to looking at that? And
I will commit to looking at it, and I'm happy to talk to you and to your staff at any time to try to help you with this issue.
Thank you. Thank you, Madam Chair.
Thank you. Senator Mullen.
Thank you so much, and thank you, Secretary, for being here. Earlier, you said that the increase for HHS over the last 4 years had increased by 38%. Is that correct?
That's right, Senator Mullen.
So what have we got? What has the taxpayers got in return over the last 4 years?
They got a worst chronic health crisis and the unhealthiest, sickest population in the globe.
So your total budget for 2024, I think, was around 1.7 trillion. Is that correct?
Yes.
So we've had a 10% increase across that. We've received nothing in return.
We've had a 38% increase in 4 years.
And at the
with
same
nothing in return.
And nothing in return. And we have my Democrat colleagues that are complaining about cutting spending. At the same time, we have NIH recipients, because we've heard our colleagues on the left side really complain about you cutting NIH funding because they call it research. But is it really research? I mean, let me just throw some numbers out here for you. Harvard received $488 million in NIH, and 69% went to indirect cost, meaning didn't go to research. Yale received $646 million, and 67.5% of their NIH money went to indirect costs, meaning didn't go to research. You have Johns Hopkins University got $858 million, 67.5% went to indirect cost, meaning 67.5% of $858 million did not go to research. University of California, San Francisco received $815 million in NIH money, and 59% went to indirect cost. But I'm sure there's no room to cut NIH money for research. I mean, who would think we probably have room for that? Because let's just use the top 4 recipients for my colleagues and on the Democrat side. Let's just use their numbers and round numbers. That's $2.807 million in NIH money for top 4 universities receiving NIH. Out of that, $1.684 billion went to indirect cost. I'm using rough numbers here. Now, I'm sure there's no room to cut NIH research, right?
There's room to cut the research both through the indirect cost, which the total cost was $9 billion last year in indirect research. So that's $9 billion that did not go to research, but also
$9 billion that went to other things like flowers at the university.
Right, and the way we don't know what it goes to.
And
the way it works is if we give $1 million grant and there's a 60% indirect cost, that means they get to keep the $1 million grant, but we have to give them another $600,000 for their indirect costs. So that's the way it works. And the private universities that have the big endowments, like you were referring to, they're the ones that get the most inflated numbers. Let me just say this. We have 9 separate offices for women's health. We have 8 separate offices for minority health. We have 20 separate HIV programs. We have 59 separate behavioral programs. We have 40 separate opioid programs. We have 42 maternal health programs. Each one of them have their own administrators. We have 100 communications offices when I came in. We have 41 chief.
Say 100 communication offices?
Yes, 100, and we have 1,400 external affair officers, staff. We have 40 procurement departments using 4 different contracting systems. We have 9 resource officers, dozens of IT departments, and 8 senior finance officials. And what we're trying to do is eliminate the redundancy. There's no way to govern this agency. This agency has a budget that is comparable to the 6th largest nation in the world. And we have no governance because these are all in silos with their own infrastructure, and we're trying to consolidate them, and that's why they don't work. That's why we throw more and more money every year, and Americans are the sickest people in the world. We spend 2 to 3 times for health care what other nations spend, and we have the worst outcomes on earth. And if somebody does not reorganize this mess, it is going to continue. And we're trying to do it, and we're going to make some mistakes as we do it. But ultimately, I can tell you 4 years from now, the American people are going to be a lot healthier.
You know, only in American government do we think throwing money at the problem will eventually fix it. So thank you for staying strong and actually getting the taxpayers the money that they spent for something that's supposed to be spent for, and that's to make us healthier. So thank you for being strong in this.
Thank you, Senator Mullen.
Senator Britt.
Well, thank you very much, Madam Chair. Want to follow up on NIH and that conversation that you just had. I think every cent of hard-earned taxpayer dollars should be used responsibly, should be used efficiently, judiciously, and we have to be accountable. And I appreciate you taking that approach to every portion of the areas in which you oversee. You mentioned, Senator Mullen obviously mentioned several of the people that we feel like are not utilizing this right and are taking advantage of the system. I want to say thank you for your comments last week at the Help Committee, where you specifically pointed out the University of Alabama and the system, University of Alabama at Birmingham.
You weren't here, I pointed it out again.
Well, thank you. I appreciate it. As people trying to do it right, trying to make sure that we can create life-saving and life-changing research that positively impacts the lives of not only Alabamians, but Americans and people across the globe. And I just want to thank you for the engagement that we have had on that issue, the continued dialogue we've had, so that we can work to try to get it right. And so just wanted your commitment to continuing that conversation as we work to make sure that we use hard-earned taxpayer dollars wisely and efficiently, and we also make sure that we have life-saving and life-changing research that continues.
Yes, Senator, and based upon some of our conversations and conversations that I've continued to have, expressing your concerns, particularly for the state schools that do not have endowments and that really need lab support and need gloves and test tubes and mass spectrometers and all of the things that you need to do do first-class science. We want to be paying for that.
Good. Thank you so much.
And we figured out devices in which we can do that, but not through the indirect cost mechanism.
Well, thank you so much. I look forward to continuing that conversation with you. I also want to thank you as a mom. So out of all of the different secretaries that we voted on and confirmed, I think my friends were most excited about you because they thought for once they had someone that was willing to take on, whether it's big companies or big tech in the name of health for their children. When it comes to social media, that's something as a mom of a 15 and a 16-year-old that I get to see the effects of firsthand, not just in my own home, but with my friends and things that are happening in the community. I wanted to talk with you a little bit about that. We've seen the rate of depression amongst young people more than double. We've seen 1 in 3 high school young women actually consider death by suicide. If you look at those same numbers, 25% of those actually made a plan to take her own life. And then you had 13% of high school young women actually attempt death by suicide. We saw the Surgeon General come out and say there needs to be warning labels on social media. People need to know about the mental health challenges that can occur from use, persistency, and that. Just want your commitment that you, obviously, as you take on toxins in the air, things that are in the environment, things that are in our food, that we'll also look at the things that are in our children's hands and how we can do better to put up guardrails to allow them to continue to explore, but to do it in a safer manner.
Yeah, absolutely. And I want to thank you for your support, Senator. I had a conversation with two of my grandchildren this weekend, and one of them used the word anxiety, a 5-year-old boy. And I was thinking that I didn't know what that word was probably until I was a teenager. I never heard anybody use it. But today it is part of the vernacular in young people. And why is this happening? Why are our kids anxious and fearful and depressed and suicidal? Our black children in this country, suicide is now the #1 cause of death. On the Indian reservations, it's now the #1 cause of death. And why are we having this epidemic of loneliness, of alienation? And some of it may be social media, and we're looking into that, and that's part of our portfolio.
Yep.
But a lot of it may be coming from our food, and we know that we now understand that food disrupts microbiome, and it causes these mood swings and anxiety, and we need to look at those.
Well, and I'd love an opportunity to work with you on that. And I know I'm running out of time. We have people that are concerned about Head Start. The news has, taken a narrative that I believe is untrue. I know that you care about the most vulnerable children. I know you care about making sure that those children have access to educational opportunities and care. And could you just speak directly to those families and providers about what this administration's plan for supporting and sustaining Head Start in FY26 and how you're working to provide them with the stability that they need to serve those vulnerable children as well?
I'm very grateful to Russell Vought. I told him how important Head Start was to me. My uncle, Sarge Shriver, started the program. There's 800,000 of the poorest kids in this country who are served by that program. It not only teaches the kids, preschool skills, reading, writing, and arithmetic before they get to prepare them for schools, but it also teaches the parents, and it teaches them how to be good parents. And we see that the children who are exposed to those programs have less contact with law enforcement later in life. They're more likely to graduate from high school and college. They're more likely to hold down jobs. There's a lot of problems with Head Start. We've kept it fully funded, and I'm very grateful to Russell Vought for that and to the president. But there's things we need to correct. One is the food that they're serving at Head Start is terrible. We need to change that. We're poisoning kids, from the poorest kids, from their youngest years, and we're going to change that. And there's other issues, too, that need to be corrected, but we're going to have a better and brighter Head Start by the end of this administration.
Well, I look forward to working with you on that, so many other issues, and also the wage index issue that is really hurting Alabama and our rural communities and hospitals. So look forward to continuing our good work together.
Thank you, Senator.
Senator Rounds.
Thank you, Madam Chair. Mr. Secretary, welcome.
Hey, Senator Rounds.
Long day already. Let me go through a couple of items that, if I could, please, and I know you've heard a number of questions in terms of where things are going. Let me share with you one that I think we may need some help from you specifically on. President Trump issued an executive order to boost the American mineral production. He did that on March 20th. The National Institute for Occupational Safety and Health, or NIOSH, mining program supports this goal by funding research at the nation's 14 accredited mining schools, including the South Dakota School of Mines and Technology in Rapid City. This includes support for critical work in metallurgy and mineral processing, fields where the Black Hills region has been a national leader. However, my office has learned that staff at NIOSH's Spokane Mining Research Division have been laid off. This office focuses on the unique challenges of Western mining, operations that are often more geologically complex and exposed to harsher conditions. This division provides critical technical support for institutions like the South Dakota School of Mines and Technology, which recently received a $1.25 million grant to improve underground mining safety. However, the grant has now been canceled due to loss of oversight from the Spokane office. This is not just a missed opportunity.
It undermines our ability to meet national security goals tied to mineral independence and supply chain resilience. Mr. Secretary, given the President's directive to increase American mineral production and the clear role that NIOSH plays in supporting research at accredited mining schools, can you help with regard to why, or can you explain, or are you aware that the Spokane Mining and Research Division basically has been shuttered? And how does this work in terms of how do we get that research done, particularly with Western mining? And this is one in which clearly the President wants us to focus with creating a supply chain within the United States.
Senator, I was able to bring back 328 NIOSH workers, mainly for soft mining, soft rock mining, coal mining in Cleveland and Morgantown. And to reinstate some of those other jobs, I will work with you. I've spent a lot of time, as you know, in your state. I've been many friends who are working at the mine up in Deadwood and Leeds, South Dakota. I've been myself to the bottom of that mine many times. I understand the health concerns and how brave you have to be to undertake that kind of work. We need to protect our miners. We need to protect them because they are the future of our country.
You would work with us to find
I want to work with you on that, and I hope
Okay.
you'll contact my office.
Absolutely, Mr. Secretary, be happy to, and just wanted to bring it up because this is one that we need to get fixed. So I appreciate your looking into it. Also, since 1995, NIH has invested nearly $1 trillion into U.S. biomedical research. In 2021, the Biden administration updated NIH's data management and sharing policy to promote greater transparency and accessibility, yet much of the research data remains siloed, inaccessible, or trapped in outdated formats, making it difficult and costly for innovators to use. This limits the impact of taxpayer-funded discoveries. To address this, I've sponsored the GUIDE Act with Senator Heinrich to modernize federal data systems, making sure that they are AI-ready and accessible for responsible innovation. Secretary Kennedy, what are the main barriers, technical or institutional, preventing NIH from creating clean, modern, accessible data sets that drive discovery and innovation?
One of the most exciting things that I'm most excited about in running this agency is the opportunity, the unique opportunity we have now to update those computer systems to crush down those silos, which we are doing. And a lot of that is just bureaucratic inertia. And what we found is a lot of, I actually learned that in order to get access to CMS data for another one of my agencies that wanted to study that data for healthcare purposes, we had to buy it from another agency there. So they're hoarding the data and they're selling it. It makes no sense. And we are bashing down all of those barriers. And we're going to digitalize our data. We're going to depersonalize it. We're going to put it on AI, and we're going to make it public through data sharing agreements that allow people all over the country to access it and take advantage of it.
Let me throw you one.
And I look forward to that legislation because I want to say this. We have been able to recruit the top minds in Silicon Valley to come into the agency, people who've walked away from billion-dollar corporations, not because they want prestige or they want position. They are there because they want to transform the agency by making it AI friendly. I spent yesterday all day talking with the innovators from private industry about how to get them that kind of data. So it's a huge priority for me, and I look forward to working with you on it.
Mr. Secretary, thank you. And my time has expired, but with permission of the chair, I need to offer one softball question for you. The combination of biomedical research in coordination with AI in terms of speeding up the processing and so forth tells us that we can make discoveries and cures for some of the main dread diseases that afflict mankind today. And we can do it within a very short time period, which not only would save federal taxpayer dollars in terms of long-term treatment, but also improve the quality of life for millions of Americans and families throughout the world. Would you agree that the combination of biomedical research with artificial intelligence accelerating that discovery process could very well improve the quality of life for millions of Americans.
It's already happening at FDA. And, you know, I had a conversation with Marty McCary last week, or even the initial introductions that we're making with AI have already quickened the clinical trial process. So, you know, well, I can't even imagine the kind of opportunities that we're going to get from this, from transitioning to AI and marrying that with biomedical research.
Thank you, Mr. Chair. Thank you, Mr. Secretary. Thank you, Madam Chair.
Thank you. Senator Merkley.
Thank you very much, Madam Chair, and good to see you, Mr. Secretary. And I wanted to address a topic that I think you and I may have similar thoughts on, perhaps the President has similar thoughts on, and that is real concern about the high cost of medicines in the United States of America. Back in October of 2018, President Trump, in his first term, noted that it's not acceptable that Americans are charged more than others in the developed world, and that we should be the most favored nation. My team connected with the White House team to say, I had a bill and to end the gouging of Americans on drugs, saying that they couldn't charge us more than the average price that was charged in Canada, Australia, Japan, and a group of the larger European nations. It seems just clear to me that given the taxpayers of the United States put more into the R&D of these drugs than any other citizens anywhere in the world, we should at least get the fairest price, not the worst price. And I believe that I read comments by you that supported that general notion.
Absolutely, and I told one of the Senate, I don't know if the bill that you're talking about is the same bill that I talked to Senator Sanders about last week, but it's something that we're very excited about. The President announced a EO on Most Favored Nation status last week, and I was present for that and helped craft the EO. And we are already in negotiation with the drug companies to discern the ways that they're going to comply with that. So it's something the President is committed to. I'm committed to. Why do we spend it? Why can an American fly to London and buy Ozempic for $88 a dose, and from the same factory in New Jersey, in the same package from New Jersey that he buys in New York City, or at a list price for $1,300?
Thank you. No, it's outrageous, and the difference. Senator Sanders is a sponsor of my bill and Price Gouging for Medications Act. The difference between his bill and mine is that I should say we should get the lowest price at which those companies are selling it to those major countries. His bill says the average price, but it's a slightly different set. But it's essentially the same concept. You offered to work with Senator Sanders toward his bill, but can you extend that same to the group of folks behind my bill, and or any bill that accomplishes this?
Absolutely, Senator.
Thank you.
You have my enthusiastic partnership in that.
I look forward to really working with you, and I know President Trump has again expressed, you mentioned the EO. The EO kind of summons the pharmaceutical companies to negotiation. I hope the negotiation, if it doesn't produce substantial results, and by the way, I'm saying it should be negotiated for everyone, not just Medicare, not just Medicaid. Like, no one in America should have to pay more than what we pay. And I think that's the general sense that you have, is not just if you're over 65, you should get a fair price. Everyone should get a fair price.
That is our position, too.
Yes, thank you. I wanted to turn to the reconciliation bill, and I apologize. Maybe this has been covered while I was over in Foreign Affairs, but I wanted to understand express my concerns about the possibility of nearly 14 million Americans losing coverage. The bill, as it hasn't come out of the House yet, but is the administration trying to work to get the version that came through the Rules Committee and the ENC Committee modified so that we do not lose Medicaid coverage?
Well, I think there's two issues. One is for Obamacare, and the other, which is that 13 million that you're talking about. The numbers that we're looking at are 8.5 million on the Medicaid, and the Medicaid, Obamacare is a little different, and that's the issue of the extension of the tax credits. Medicaid is the cuts there are not really cuts; they're basically cuts in the growth of the program, and those cuts are to eliminate waste, fraud, and abuse. And I don't want to just use those words. And I talked about this a little before. There's 1 million people that we've been able to identify that are collecting Medicaid in 2 different states, which is illegal. There's 1 million people that are collecting Medicaid and Obamacare, which is illegal. There's 1 million illegal aliens who are collecting Medicaid, and they will be eliminated. The remaining people are all people who are able-bodied, who do not want to meet the minimal standards that President Trump is establishing, that they either have a job, they have a part-time job, they're looking for work, or they're getting an education.
So I hear your arguments. I have seen evaluations of this program that consider it to go far beyond just that sort of. I support the waste, fraud, and abuse of people double enrolled in various programs. But one of the things, for example, is we had a government efficiency so people could enroll in SNAP and Medicaid at the same time. That's being severed, which makes it, if you're a single parent, you're raising a couple kids, you're working 2 or 3 jobs or minimum wage jobs, and at the same time you have to go in every 6 months and revalidate your income, apply for 2 separate programs. I mean, the reality is it's extraordinarily different for ordinary struggling families to do that. And the goal is to cut down the number of people by making it difficult. And I don't think we should make it difficult for folks who are trying to be on their feet and raise kids. I wanted to note that the loss of people enrolled in Medicaid, and I consider health care a right, not something that is you achieve because you're wealthy enough to buy it. I think every developed country but the U.S. has said health care is fundamental to a thriving population, so they strive to make sure everyone can have access rather than trying to create obstacles to access. So I'm concerned about this obstacles to access approach. But where I'm really hearing from are our rural health care clinics and our hospitals, because they are on the edge right now, and they are shutting down birthing centers. They did so in Baker. I have a picture of your father when he was in Baker, well, during his presidential campaign. And so now people have to go down in eastern Oregon where there's horrific winter storms, an hour to get to a birthing facility, or more than an hour. Anyway, I'm concerned about these rural clinics and hospitals that are on the edge going to be shut down when a lot of people won't be able to pay.
If I could interject here, sorry, Senator.
Am I over time?
Yeah, you're over time.
Such
and
an
Senator Bo's been here the whole time, and
the
Secretary's up against a
those hospitals.
a hard
I'm
stop.
happy to talk to you. I appreciate that your civility in here today, and I'm very, very anxious. I agree with you on all the issues that you talked about. If you call my office and want to talk about it, I
Great.
would like to.
I will absolutely follow up. Thank you very much.
Okay, Senator.
Thank you, Madam Chair and Ranking Member, again, for having this important hearing. Thank you, Mr. Secretary, for being here. Cancer remains one of the leading causes of death in the U.S., as you know, and early detection through screening is critical to improve outcomes, reducing long-term health care costs. The national...
I didn't hear what you said.
I said that early detection through screening of cancer
cancer,
is
okay.
critical to improving outcomes and reducing long-term health care costs. I'll try not to mumble. So, National Cancer Institutes are designated cancer centers that deliver cutting-edge cancer treatments to patients in communities across the United States. Yet there are no NCI-designated cancer centers in Arkansas, Mississippi, or Louisiana, states with some of the highest cancer mortality rates in the country. Arkansas has been working really hard on that designation for the last several years. We know that strong federal partnerships are essential. We really would like your help as we go forward with that, again, in providing this ability. How can we help HHS prioritize investment in prevention, screening, and infrastructure, particularly in rural regions, to improve cancer outcomes? You know, you talked earlier about what can we do to, you know, really get a handle on, you know, certainly nutrition is important, but again, besides that, as we go forward.
We need cancer treatment, and I'm aware of the application by the University of Arkansas to get an NCI designation, and I'm very anxious to help you with that.
Good. Thank you very much. As chairman of the Ag Committee, I appreciated your comments last week in the House recognizing the difficult position our farmers are in. I'm concerned that rural America is struggling, especially our farmers. Nearly half of Arkansas's counties lost population between 2022 and 23. That would be true of most of our rural counties in America. Farmers and rural Americans often face barriers to accessing health care and including provider shortages and transportation challenges. Providers in rural communities struggle to keep the doors open, leading to gaps in care. Programs like the Rural Residency Planning and Development Program would be especially effective in helping train and retain physicians in underserved rural areas. We're in the process now of working on a farm bill, doing some things to support not only the farmer, but rural America in general. How can we partner with you? How can we partner with the HHS to develop sustainable health infrastructure that ensure that federal policies help attract and retain providers in healthcare deserts?
You know, we have a number of programs under HRSA that are intended to do just that. One of them is the 340B program, which is very controversial. It's now under litigation. But we understand the importance of that program to rural hospitals. The GME program, which is designed to get providers, badly needed providers, into those regions. I would also stress that we're about to see a revolution in AI, and AI, you know, I had a showcase of an AI nurse yesterday, which is just an extraordinary innovation that could revolutionize health delivery in rural areas. We met with people, companies that are building apps that are now used by millions of people that give access, direct access to health records and give transparency and the ability for people to immediately discern, and wearables also give the capacity for people immediately to discern which direction they're going in on a whole parade of metrics, and allow you to, even as you eat food, to in real time evaluate what it's doing to your body and to take control of health. And I think in rural areas, particularly those areas that don't have access to hospitals, that it's going to revolutionize. I'm very excited about that as an innovation that can transform rural health care. But I also understand we got to keep those institutions in those regions because they're important economic drivers. And for people who really do need to visit an urgent care or an emergency room, they're life-saving. So I want to work with you and do everything that I can, and the other senators, both Democrats and Republicans, want to make sure that the 60 million Americans who live in rural areas have, and who are critical to our culture, to our economy, to our history, and to every other value, that it's critical to keep them in those areas and healthy.
Thank you very much. Thank you, Madam.
Thank you, Mr. Secretary. I know you have a hard stop at noon, but we've got one more question here. Senator Schatz, and then we will wrap up very quickly. Thank you.
Thank you, Chair. Thank you, Secretary, for the extra 5 minutes. Good to meet you. I want to tell you a little bit about my dad. Dr. Irv Schatz was the first physician on the record to question the ethics of the Tuskegee experiments. For years, the United States Public Health Service withheld penicillin from African-American men with syphilis to quote, study the disease process. And so I'm thinking of my dad when I ask about a statement you made during last week's HELP hearing questioning the recommended childhood vaccine schedule and implying that these vaccines should be tested in children against a placebo control like a saline shot. I just want you to know this is not a gotcha. I'm hoping that I misunderstand what you're talking about. You know placebos exist, placebo-controlled trials exist in the existing vaccine approval process. Are you suggesting something different than that?
There are placebo-controlled trials, Senator. And by the way, my uncle, Ted Kennedy, in 1975, held the hearings that ended the Tuskegee experiment. And so I'm very, very familiar, and I've met some of the people who actually suffered from that. Under the current vaccine schedule, none of the vaccines, with the exception of COVID, have ever experienced a safety trial pre-licensure that involves an inert placebo. None of them. COVID's the only one. And I don't think that it's ethical to go back and retest those vaccines against a placebo, if that's what you're suggesting.
That's what I'm trying to clarify. And
No. But you know what? The Cochrane collaboration in 2016 published a study that showed that the predictive capacity of placebo-controlled trials, which are the gold standard, is actually not any better than good observational trials and retrospective trials. So we can do those kind of studies without subjecting people to an unethical experiment.
That's all I wanted. This is not a gotcha. I wanted to just clarify that we're not contemplating population-wide studies. Okay, great.
And they do, just to clarify, they do have efficacy tests against placebos, but they don't have safety testing.
It's a biological fact that as an Ashkenazi Jew, I'm more likely to carry the Tay-Sachs gene. We know that rural Americans are less likely to receive preventative health services than people who live in cities. We know that liver cancer is more than twice as common among Asian Americans than white Americans. I just want to clarify, as the administration attempts to root out what they consider to be DEI, that we are not characterizing biological differences between the sexes, among races, among people who live in different parts of the country, and the study of those, because obviously in the administration of care, whether it's medicine or other health care, we want to know how different people respond to different courses of treatment or preventative care or whatever it is. I'm assuming you don't think that's DEI. Is that fair?
No, absolutely not, Senator. And you know, I was talking before you got in here that we worked with Senator Tim Scott on a very, very innovative program that we approved 3 weeks ago in South Carolina to deliver a new cell therapy to people, to every person in South Carolina who has sickle cell disease.
Right.
All kinds of diseases that affect certain races that have manifest sexual dimorphism, and that's nothing to do with DEI.
Okay, so I think the challenge is, and this is not just your agency, but really government-wide, is that the first cut at eliminating, scrutinizing, freezing, reforming grants, projects, lines of funding has been this basically sophisticated version of Control F, where you look for the word gender, or you look for the word race, or you look for the word equity. And I would just ask you to relook through your departments at whether or not some of this stuff got swept up accidentally, and it's not some PowerPoint presentation to your workforce to divide them according to race and tell people what words to use to describe themselves or others, but rather a kind of foundational aspect of medical research. And I just would like to be reassured that you're taking a second look after the kind of first Doge script was written to flag anything that could be problematic from the standpoint of the Trump administration.
We are doing that, and we've already rectified a number of studies that were eliminated based upon those presumptions because they fit because the search terms made them look like they were DEI. And when that happens, people call me, and I call Jay Bhattacharya, and I say, will you take another look at this? And in several cases, he's reinstated them. We do not want to lose that kind of science.
Thank you.
Thank you. Thank you, Senator. Senator Baldwin's going to make a quick statement, and then I'll wrap it up.
Yeah, Secretary Kennedy, I do want to make sure that we correct the record on the lead program that we've been discussing back and forth last week in this. There are no staff on the ground deployed to Milwaukee to address the lead exposure of children in schools, and there are no staff left in that office at CDC because they have all been fired. I look forward to working with you to reestablish that. It sounds like you have a commitment to that, but we need staff in order to make it function. I do have some further questions for the record, and understand that we will have an ability to submit those.
Yeah. So this ends our hearing today. I really thank you and my fellow committee members. You had full attendance today, so you're a popular guy, but a very thoughtful conversation. And thank you to Secretary Kennedy. For any senators who wish to ask additional questions for the record will be due 1 week after the full budget request is released. The hearing record will also remain open until then. For members who wish to submit additional materials for the record, the subcommittee will stand in recess, and thank you.
Thank you, Chairwoman Capito. And thank you, Senator Baldwin.